Here at Mayo Clinic, Arizona, we have lots of sun, a great group of rheumatology fellows, and a great rheumatology fellowship program. The Rheumatology Fellowship Program aims to train excellent clinical rheumatologists who will have the capacity to lead the field of rheumatology as it evolves over time. Graduating fellows will have the experience to excel both in clinical and academic rheumatology. Clinical expertise, musculoskeletal ultrasound, and academics are all emphasized in the training program.
Ultrasound practice is an integral part of the Mayo Clinic Arizona Fellowship Program. Our ultrasound practice is one of the very few rheumatology practices in the country to have dual diagnostic and procedural accreditation from the American Institute of Ultrasound and Medicine.
In our rheumatology program, we take great pride in collaborative and multidisciplinary research in the areas of scleroderma, vasculitis, interstitial lung disease, ultrasound, and many more to come. Every fellow gets exposure to the world of clinical research with a matched mentorship.
When I see patients in clinic, I usually have my own ultrasound machine that I use, and I feel like it's been really helpful to me and to my patients actually as well. I feel like I can get answers quicker for the questions that are coming in. I can see if they're responding to treatment or not. And I also get to build my skill and my experience with ultrasound.
Because we're a large tertiary care referral center, we have the opportunity to see some of the cases that have really, bubbled their way up through the community level providers, and because sometimes we have patients who are here looking for a second, third, fourth opinion, and they've already been to multiple rheumatologists before. On the hospital, we see some of those acute cases in the acute setting, and then we, kind of inherit them as our own patients on the outpatient side, and then follow them as part of our continuity clinic. So that allows us to get a glimpse of the acute care in rheumatology, as well as some of that ongoing outpatient care.
It's never hard to find things to do around Phoenix, Scottsdale area. It's a great place to be if you love being outdoors. It's a nice thing that you're able to do things all year round. I love to play a lot of sports around here, so golf, pickleball, those are easily accessible. Scottsdale has a wonderful park system that's open to the public, so there are many of those scattered all throughout the city. They offer great places to take kids if you have those, but they also have a lot of sports, including intramural leagues that people can play in, which is always a good time.
I really appreciate the mentorship that I got here, and I didn't imagine that, 6 or 9 months into training, I would have acquired the amount of skill and experience that I have.
Coming into the fellowship, I didn't realize that I would be able to build that hands-on experience, but now just kind of seeing myself get more and more comfortable with the ultrasound, appreciate what I'm able to see on the ultrasound, and learning that skill has been very enjoyable.
I think one of the best things about it, honestly, is the level of oversight that you're provided while you're there. When you're starting out, you're not in a position where you're kind of left out to sea on your own. You always have appropriate oversight when needed, and as your skills, your confidence, and your knowledge grows throughout your fellowship, you are given the opportunity to really exert your control over the patient list that you have and feel like you're empowered to do so from the consultants. So that was really helpful for my growth.
Our fellowship training program has features that excite and motivate residents interested in the field of rheumatology. Please consider applying to our program in the future and for your future.